Doctors have read it. What is your craziest story where a patient present with mild symptoms, thinking it was nothing, and it turned out to be a serious life or death situation? Many years ago, when I was in my residence, a man entered ER with a hand in his forehead, walking by himself, asking for a doctor. You can imagine my surprise when I said yes, to him removing his hand and showing his injury, a perforating hole from a bullet. He was quickly moved to surgery after that. Later I found the bullet didn't reach the brain, it was well buried into the skull bone. A man came to the hospital because his wife always complained about his bad breath. Long story short, I met him because they consulted my department when the tissue biopsy came back as esophageal cancer. I'm a dentist. New Point came in with what he thought was a mild ache in his teeth. Thought it was a toothache. Hadn't seen a dentist in years. Took a radiograph and the jawbone around the teeth looked strange. Had him see an oral surgeon that day. Turned out was a very aggressive metastatic bone cancer and died a few weeks later. I'm a nurse, not a doctor, but we had a guy come in years ago asking for a medication to help him stop sweating. He said he had had a sore throat for about a week, went to a walk-in clinic, was diagnosed with strep throat and put on antibiotics, but he was so sweaty and just wanted a break from it. He looked pale and was indeed sweaty, so we took him back and ran some blood tests. His white blood count was the highest I've ever seen and he was diagnosed with leukemia. We sent him to another hospital for immediate treatment, but we were informed he died literally hours after arriving. Incredibly sad, I couldn't believe it.